First, I want to thank all the witnesses, and I think Mr. Altmaier described our appreciation adequately, but I just want to express my own personal thanks. I want to thank staff for putting all this together. I don't think we ever say thanks, but they prepared the memorandum, they provide us with your testimony, and they coordinate getting you here, and I know that that's a tough job. What we're trying to avoid is that we don't want a healthcare professional to go out there and having to sue the federal government to stop from implementing regulations. We want a streamlined system that promotes good practices and pays you fairly and compensates you as you should be. We really aren't that interested in having to go through the legislative process if we can work it through our regulatory scheme of things, and that is if CMS listens carefully and makes sure that it takes into consideration the impact, the consequences of their regulations. And that's what we're doing here today. Hopefully we have those lines of communication. We understand that sometimes that lawsuit that people file is necessary, and surely that legislative intervention at times is the only way. But please understand, we're trying to do this collaboratively, and we appreciate your input. And I will ask unanimous consent that members will have 5 days to submit statements and supporting documents for the record. I thank my colleagues for their participation, and without objection, that will be ordered, and this hearing is now adjourned.